Hi everyone, this is Tulsi Desai. I'm a physical therapist. So I have come across a question from a relative who had a patient that was curious about knee replacement and post-operative care for knee replacement and what to expect after surgery. And I think that's a very common question that a lot of people have when they have knee joint pain or they have chronic knee pain, and doctor tells them that they might need a knee replacement soon in few years, or they actually need knee replacement right away because the joint is really painful, not in a good condition, probably bone on x-ray. And you would know generally because most of the time it's not overnight that your knee joint hurts you too bad and you start considering knee replacement. Most of the time you have been having knee pain for years, you ignored it, you tried physical therapy for a while and it helped for a few months or few years, and then again something happens and your one knee or both knees just are really painful. You try medication and all that, then eventually it starts affecting your lifestyle, and you limit yourself on what all things you can do. Maybe you avoid going upstairs because it hurts to take stairs or it hurts to come downstairs. You stop sitting down on the floor because it's really hard to get up from the floor. You know that the knee joint is deteriorating and you will need surgery at some point. But also having surgery is a very scary thought. So it's good to make a list of questions that you would want to ask your surgeon. That way, hopefully it will decrease the fear of surgery in general, and also you would have realistic expectations on what to expect after knee replacement. Knee replacement can completely change life for some people when it's successful and a person goes through proper rehabilitation. I also recommend, if somebody asks me beforehand, I recommend them go through prehab. It basically means pre-surgical rehabilitation. So you learn what all exercises you will be doing after surgery. You can ask questions to your therapist as well as your surgeon. You can learn what to expect, what kind of exercises or precautions you have to take after surgery. So let's say you go through surgery. The first day, actually the therapist will come to you while you're in hospital. First day they will try to promote weight bearing on that leg, even maybe try making you walk, and then generally people get discharged in 2-3 days after knee replacements. If there are no complications, you will be given instructions on how to take care of your scar because it's a big scar and you want to make sure you don't get infected. I think that's the major risk factor or complications to any surgery. So you have to make sure the scar heals well without any infection. You will start having some kind of physical therapy at home initial few weeks, or at least initial 1 or 2 weeks, until you're ready to go walk on your own and go to physical therapy center. But you can start walking with some kind of assistive device, crutches or walker, within a day or two. So the outcomes are really good. You're not as bedridden as you would expect after a major surgery. Also, the most important part of rehab is getting your range going. So the knee bending and full knee extension is really crucial, and the therapist will try to give you exercises to make sure you're moving that knee and getting the range you're supposed to get. And I think you would be in physical therapy for at least a good 12 weeks ongoing treatment, and in the meantime you learn so much. And if you're making good progress and if you're achieving the range that you should be achieving, so by 12 weeks if you have good 120-degree knee flexion and 0-degree extension, the therapist will give you home program and you can continue to do that. Some patients progress slower than others, then they could be in therapy for longer time, but you can pretty much have normal daily activities, and you can even play golf, go swimming. Like, there are a lot of things you can do after a good rehab post knee replacement. So I hope that was helpful, and if you have specific questions for your lifestyle, like, oh, I need to be able to sit in this position, make sure you discuss your goals with your surgeon and your physical therapist before you go into surgery, so you have realistic expectations of post-surgical rehab. But I think knee replacements have good outcomes. So if your life is limited because of knee pain, and if your surgeon is considering that, if you're not sure, if you are not 100% sure, go take second or third opinion, and then if everybody agrees that you need knee replacement, you most likely need it. Okay, bye.